The reason the new orders came down so late today, the chief provincial public health officer was here in court. He was called to take the stand by a group that contends public health restrictions violated their charter freedoms. The applicant's lawyer, Jared Brown, argued the province could have better focused their resources if they had information about how infectious cases were. Information he suggests could come from CT values that are not regularly reported to public health. Dr. Brent Rusin said CT values do not help public health because they are not perfect tests for transmissibility. Rusin said they can't rely on a CT value that might suggest someone is low risk, then send them back to work at a personal care home, for example. He argued a far better tool is the one they already use, the PCR tests. Rusin said in the second wave, he expected 7% of positive tests to end up in hospital and 1.4% in the ICU. He says that is indeed close to what happened. So if we have 400 new cases one day, about 28 of them would land in hospital 10 to 14 days later. A week of 400 daily new cases would see about 39 people in the ICU. Rusin testified to hospitals being overwhelmed in the second wave. He said the goal of public health is to minimize the impact on the healthcare system and high-risk communities. Rusin said he is bound to using the least restrictive measures possible to minimize morbidity and mortality, and looks at it from a whole health approach, watching non-COVID issues. Brown said he's skeptical of that, saying there was no evidence of a restriction harm-benefit analysis submitted to court. Rusin said he engaged with a range of healthcare providers on different sides and with national partners to ensure the benefits outweighed the harms. He said he never took implementing restrictions lightly. In Winnipeg, Stephanie Lasuc, City News.